Jen join us to talk us through what our product strategy is and how it kind of hooks into that business strategy, and specifically as it relates to how we think about the next chapter in terms of connecting the downstream ecosystem.
Great, thanks so much. Well, I'm so excited to be here with you to help Zach close out this amazing 2 days of discussion and debate and learning. So I am going to give you a bit of a window into this next chapter for Hint, as Zach mentioned, about connecting what you all do in DPC to this, what we refer to as the downstream ecosystem, the things that are happening outside of primary care. So you saw this this image in Zach's presentation a few moments ago, kind of a simple depiction of the different types of care that we believe can be delivered via direct care and direct pay. And so according to our analysis, which is probably even a bit conservative, we think about 60% of the total spend in the US can be converted to a direct care or a direct care / direct pay model, or about $1.8 trillion. So put another way, we think $1.8 trillion of spend in the US can move to this model. And when we do, we believe that there are 30% cost savings to be had by making that shift. We also know, based on survey data from that recent Milliman report, that 86% of the time, DPC doctors are referring patients less often to specialists than their fee-for-service peers. So we already know there's an impact, in the referral patterns from DPC, but we think if those referrals can go to these direct care and direct pay settings, 30% of cost savings could be had. So a really big why there for all of us. And, as we know, we heard from Dr. Kristen Dickerson this morning from Green Imaging. We know this is already happening out there in the marketplace with direct care, direct pay diagnostics. We see Quest even getting in this game with direct-to-consumer labs. And then, of course, Surgery Center of Oklahoma with their case rates for surgery right out there on the website. So we know the market's moving in this direction. We hear it from you. We see it happening in the marketplace. And then interestingly, because not all of this downstream care is being delivered outside of your walls, we see it happening inside DPC where you're expanding your services as well. So we took a look at our data over the last 12 months, and we saw that 16% of the charge volume that goes through Hint are non-membership charges. So that 60% of everything that goes through Hint are related to incidentals, things that you're charging for outside of the membership. So of course the membership stays at the core, but we know other things are happening as well. That represents 604,000 charges billed in the last 12 months across 31,000 distinct items. So, certainly something going on here. So we look at what's happening out there in the market, we look at what's happening inside Hint right now, and we know that now is the time for us to move where you're already moving, to move outside, but outside the membership and outside the DPC. So someone made a great analogy to me this week when we were getting ready for the summit, that what we're really trying to do is pave an unpaved road. So this road, you guys have already built the road. It already exists. You've cleared the trees, but it's probably still a bit difficult. There's probably still some paperwork. There's probably still Excel spreadsheets and phone calls. So what we want to do, this is what technology is meant to do. What our product is meant to do is make all of that easier and seamless for you, and have it just happen automatically behind the scenes. So as we seek to pave this unpaved road, this first phase is we want to expand the plan inside the DPC. This is a really important stepping stone for what I'll talk about next, but also something that will help, today. So what you see here is an example of where we're planning on taking the plan. So as you know, any of you who are Hint users, you can create pretty much any kind of membership plan within Hint OS. But what we're going to be adding to that is the ability to specify what's covered under that membership and what isn't, or maybe it's partially covered. Maybe the employer is covering part of it and maybe the employee is covering the rest. Maybe you have different types of plan offerings. Maybe you only have one all-inclusive plan. All of that would be supported under this, but we want to add the ability to structure this a little bit more so that there's less work for you to do in the system as you're billing those 604,000 charges through Hint. So as we do that, you can see an example here of what different plans might look like. So, again, some of you have one all-inclusive plan that completely stays supported. Some of you have multiple plans, and we see you build those out in Hint OS at different price points. So we've got one example here of a basic plan, $50 PMPM, unlimited medical visits and some low-cost labs, all the way to a more comprehensive visit that might include more services under that PMPM. So giving you that flexibility, making the plan building more robust. And then finally, how that might actually play out on an invoice. You can see here over on the right, we've been able to split those charges to the patient and to the employer. You can clearly see what's been covered, what rules is kind of firing here behind the scenes to designate what goes on the invoice. So this is kind of this phase one. We're actually going to be starting on some of that work in the next few weeks, so very timely, and we're really excited to get started on this path and look forward to working with you and getting your feedback on it, most importantly. And then the phase two is moving outside the walls of the DPC. So we know that you are providing a lot of care within your walls, but then you do have to refer the patients outside of your practices. And how can we do that and make it easier, make it more seamless, and have that plan that we were talking about, that more robust plan, follow the patient? So here is one example of what it might look like if we had HintOS built in, say a diagnostic center, which is this, with this example, where we're not talking about active memberships anymore and PMPMs. We're talking more about a direct payment for a service that's been provided, in one of these other settings. So I'm going to walk you through last part of the presentation here, just a couple quick examples of how this might actually play out. So here you've got an example of a basic plan. That basic plan, lower PMPM, x-rays aren't covered. And in this example, the patient calls her DPC doctor. The doctor refers the patient to a diagnostic center for an x-ray. The x-ray is performed, and because that plan information followed the patient to the diagnostic center, the plan rules show that this x-ray isn't necessarily covered by the DPC plan, and the patient's going to pay that full amount at the time of service at the diagnostic center. So we can support that, in the future through HINT, all of that running, the plan attached to the patient, the payment done right at the time of service. All right, the second example would be a more comprehensive plan where x-rays are covered by the DPC plan, but the DPC location doesn't have an x-ray machine. So same use case, the patient calls the doctor refers the patient to the diagnostic center, patient shows up, again, the plan followed the patient there, and the plan rules show that the DPC plan is covering x-rays, and this is a use case I know some of you are already doing. So in this case, the DPC can pay the diagnostic center, again, immediately all through HINT because that plan followed the patient. All right, and this last example, how this might play out for employers, in this case, the employer splitting the cost of the x-ray with the patient at 50%. So same use case, the plan followed the patient again, shows that the patient's responsible for half of the payment. Patient can pay their right at the point of service, and the employer can pay the remaining. So in this way, we're giving access to these direct care, direct pay workflows and arrangements, up to the employer as well. So we know that these things are happening out there in the community, that you're building your networks, but we want to make it less cumbersome. We want to make it easier for you and for the patient.
Hey, so Jen, awesome work. And I wouldn't know what I'd do without you, Jen. But just a couple of questions here. So what you're saying is that we're going to build out HintOS for other types of practices other than primary care. Is that kind of what I'm hearing?
Yeah, that's what you heard. That's what you saw. So that would be the plan, that we would be able to build out HintOS, but build it for some different use cases than, the world centered around membership. Still direct care, direct pay. We're not recreating, practice management, but the ability for other types of care settings to leverage direct care and direct pay. And as we do with everything in our product, everything is accessible via API. So if integrating with other systems is the best way to go for those centers and for DPCs, that's something that we would be able to do as well.
Great. So I can see how this will make it easier for the providers involved. But what do you see as the benefits for patients? How does this actually impact the patient, and so why does it matter, I guess?
Yeah, great question, because of course, if it doesn't benefit the patient, it's not something that, that we want to do. So I really see the benefits to the patients as twofold. So one, even in this world where DPCs are forming, their own networks in their communities, and we have more and more, downstream providers going direct. I even heard this morning an example of, multiple phone calls that have to happen to make all of this this go? So I think, number one, this removes some of that administrative barrier that could get in the way of the patient getting that downstream service that they need. And second, we know cost is such a barrier for patients getting the care they need. If we can enable DPC to go to a direct provider and let patients get, take more and more advantage of those, of those cash pay rates, we're hoping that we can remove the cost barrier to patients getting the care they need as well. So removing administrative barriers and removing cost barriers.
Great. And Jen, we've just got one more question here. So I know we've got a lot of DPCs out there who are already connected with direct pay specialists and facilities. Will we be able to help any of those that do or don't, or who want more of this, to sort of help connect them to these types of specialists? How will that work?
Yeah, absolutely. So, similar to what you described around affiliates, things were already happening in the marketplace. We, built our technology to support it. But since then, we have more clients, more DPCs coming and asking us, hey, can you connect me to another DPC? Do you have anybody in this area? We're going to replicate the same thing as we move downstream. Many of you have met or worked with Beth Holmes, our network development lead. So we just want to extend the ability to connect you to each other, both outside of the product and inside the product, to help you build bigger and stronger ecosystems and really add more color to your diagram there, Zach, and more connections.
Fantastic. Thank you so much, Jen. Always great to hear you presenting, and I'm sure everyone really enjoyed that. So thank you so much.